we see the lobes. Yes, here is 3 lobes, here is 2 lobes, for example. And when we do the auscultation, we should check the sound. So as you said, we have normal sounds, bronchial, vesicular, broncho-vesicular sound, and it depends on the localization. When we do the auscultation, we start from the apex of the lungs, of the 2 lungs. How we do the auscultation? First word, your arms should be clean and warm, because it should be comfortable for our patient. Also, your instruments also should be warm and
Clean.
clean. And you ask for the permission to the auscultation, and you are telling to the patient, for example, how you do it. I will do it now, for example, it will be very fast. Please breathe normally. Do the not deep and not short, breathe in and breathe out. So he is staying, for example, you are using your instruments. And do it symmetrically, because we should do it from the two sides and compare. And we compare the lobes. For example, first of all, we hear the
Middle rib line.
Midline.
it's not about the line. It's depends from the localization, because on the bones you can't hear anything. You do it through the bones and the open area. For example, it also depends on the structure of the thorax. The men always have a bigger size between the ribs, yes, and you can hear it. So all the mechanism is you can hear all the sounds between the ribs. So here you can hear the sounds like from our larynx, yes, from the larynx. How we check it? We ask the patient to talk and to say some words with a so tractor, it's maybe in Russian or in English, for example, something with the and you are hearing. If you checking just for the normal, you do it symmetrically on the upside, symmetrically, and after that you goes by the border. For example, here you can hear. And here we have sinuses, yes? Sinuses we are checking from the back side mostly, but you know that you can see and check it from the front side also. From the back side, for example, what we see from the back side. Also, it can be upper lobes, right, left, and so here you see the just projection of the lungs, yes. But how we do the auscultation? Our auscultation should be also symmetrically, and we do it not on the scapula. Here we have 2 scapulas, and we don't hear it clearly on the bones. Because of that, we do it between the bones, So we hear the apex. So like this. We check it
Towards the border.
And after that we go near the vertebra, like this. Two sides you compare it. Yes. And when you go to the sides, you can ask the patient do very deep breathe in and slow breathe out. For what? We checking the sinuses. If the patient have some pathology, it can be connected with the vessels, it can be connected with the pleura and so on. For example, if we have some pathological liquid in sinuses, we can hear
like the pleural rub.
Yes. Or if you do the auscultation and hear some pathological sounds as crackles,
sounds,
or wheezing sound, for example, you can do it exactly, and you can hear the sinuses when the patient do it like. So his lungs are coming upper, yes, and you can hear clearly the sinuses here. He will do like this.
in the case of asthma,
Wheezing sound.
wheezing sound.
So you should understand that when we hear the sound, you will hear the breathing in and breathing out. And all pathology, it depends from the what is the pathology of the sounds. For example, if it's pathology connected with obstruction, something like in bronchial asthma, the
The narrower tube and air goes
The
throughout.
crackling
So
sound
if
is
connected
heard.
with the obstruction, the
Yeah.
sizes of the trachea and bronchus will be
Decreases.
changed. It decreases, as you said, and it have some contractions. Because of the contractions, air will come in and
Not
There will
pass
be-
easily.
yes, and not pass, for
That will
example,
cause a
and
sound.
not goes very good to the, for example, for the bottom of the lungs. And because of that, you will hear some pathological sound. So let's hear the normal sound, bronchial, for example, here. Bronchial sound will be like this. So, for example, on the left side, you can hear. If you will do the auscultation, you will hear something like this. It means that you hear the bronchial.
Loud sound.
Also, you can hear the vesicular sound. Vesicular, little bit changing.
Low pitch sound.
And less loud sound.
सीरीड में तो उनके होता है ऐसा
ये normal है.
ये नॉर्मल है
Also, it can be bronchovesicular. Bronchovesicular will be a little bit mixed.
ये उनके होती है
All these types depends on the localization. For example, for the pathological sound, what type of the pathological sound you can hear? You said about the wheezing sound,
Crackle, wheezing, bronchi, strident, then pleural rub.
Diminished sound.
First of all, it's a wheezing sound. For example, what does mean wheezing?
It's a musical sound
Musical sound.
that is caused due to
bronchoconstriction and there is problem in
when the lumen is smaller.
For example, if we see some pathology in a segment, on the one of the segment, for example, and here is some inflammation area. On inflammation area, we can see, for example, for the tuberculosis, for example, yes,
Yes,
it's
TB.
mycobacteria, and we can see some cavernas. So in caverna, you see the air inside, and when the air is coming through the bronch and goes to the caverna, you will hear like this one, yes, wheezing. And the type of the wheezing also depends on the location and on the sizes of the cavernas.
Tubes.
It can be big, so like this. It can be little, like this. Also, it depends on the age of the patient.
Yes.
If it's adult patient, it can be bigger. If it's a small patient, as children, it can be very little. Yes, and it will be fast because almost babies are breathing too fast.
Too fast, the breathing rate is very high.
Also, you can hear the stridor. Stridor, it's a pathological sound.
It's a musical
as you
howling sound.
hear it, it's like a laying of the dog. You can't use your instrument, but the patient with the stridor, as you know, it's mostly the children from 1 to 3 to 5 years old. It's a viral infection and inflammation in the larynx.
Bronchomalacia in the
In
case of
larynx, don't give the patient to do good breathe in, and so that's why you can hear it's like the air is not coming good, and going out very low. So it's like. And you don't need an instrument to hear it. It will be connected with the larynx. You will hear it from the side, from the 2 or 3 meters when the baby is coming, and the mommy will tell, oh, it's not good, for example. And it's, as you know, the stridor needs emergency treatment. For this one, we need to do the inhalation with adrenaline to take the edema. And when this edema is off, the larynx will come better and the size will be normal, and child will breathe normally. Yes. So you should know that stridor mostly on the children, and mostly it's like a laying of the dog and connected with the breathing in. Okay. Crackles, wheezing sound can be mostly on the adults, and it depends on the sizes of the pathology. So the pathology of breathing out, if you hear. So
Little
air
heavy.
is coming, but not
Going.
coming out.
Not coming out
Coming
easily.
out properly.
There is a
Comes in,
blockage.
but not
Obstruction.
coming out.
Blockage नहीं होगी. Block कर देगा.
So if we will do the if we will do our breathing faster, it will be like this. So 30 per minute. How we call it?
Asthma.
No.
No.
Asthma is a
Shortness
disease.
of breath.
How we-
Shortness of breathing. Hypoxia.
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 So it means that the body don't have enough
Oxygen.
clear oxygen, and the oxygenation process is distracted. So after that, the all systems of our body will
Need
give a
oxygen.
signal to the brain, and our breathing will be fast. So
Respiratory
you will have to
increases.
do very fast breathing.
But this are also here will in the case of long run or workout.
Also, it depends on the, as you said, BMI of the patient. If it have a very
High
for
BMI.
example, obesity of the third stage, for example, and his weight about 150, very big. So it means that the lungs are very heavy, and the lungs will как бы давить, pass to the heart, and the heart will work very fast. So it means that we will have very
High heart rate.
big problems with the vessels. After that, it will be connected with the respiratory system and with the breathing also. So all the pathological signs are connected with each other, and all the systems are connected. And you can hear and see it on the pathological sound. Normally, now you should know the normally how we do the auscultation, what the normal sounds and what can means the pathological sounds. Okay, and because of that, you need to knowledge of the anatomy, top anatomy and pathological anatomy also. If you will understand how it's working, how it's connected, you will be very good doctors, and you will give a good treatment for your patients. Okay, so for your